It is every mother's joy to give birth to a healthy, bouncing baby and watch them grow strong and full of life. However, due to various factors including nature and a lack of awareness, this dream is sometimes shattered. Many babies and children develop different health complications from birth, some of which go unnoticed. One such condition is childhood blindness. The Ministry of Health estimates that 4.5 out of every 1,000 children have low vision. This is Mommy Greta, a courageous mother of an 8-year-old daughter. She is one of those parents that experienced the horror of delivering a child that did not see at early childhood. At birth, everything seemed normal, and she was discharged with reassurance that her baby was fine. However, after several observations of the baby's eye contact, she grew concerned.
Omwana bwe nalinga muyonsa ng'omwana tantunuulira mu feesi bwe naddayo okumugema ne mbabuulira abo abakyala abazaalisa kati ne baŋŋamba abaana abato tebalabirawo amaaso tegalina buzibu ne bagakebera ne bagamba tegalina buzibu. Era nange ne nkomawo n'omwana wange ne mbeera nga muwa ebbeere nga naye nze amaaso ngalaba. Kati bwe yaweza 10 weeks era balina akayiso ke baali balina okumukuba era ne mmuzaayo bamugeme era ne mbagamba omwana era tantunuulira tanfokasingako bwe mba muwa ebbeere tantunuulira. Kati ne baŋŋamba era omwana ne bamukebera abo ba midwife abazaalisa ne baŋŋamba era omwana talina buzibu amaaso gali bulungi.
At this point, she was faced with a difficult decision. Her child needed surgery. However, not everyone in her family agreed. Some strongly opposed it, describing it as a minor issue that can be treated with herbs.
Mama agambye Greta tekyetaagisa kumulongoosa waliwo eddagala lya habo waliwo n'omwana omulala ndoozi famire nze sibamanyi nangaalo n'omwana omulala gwe kyabaako ekyo naye bamuteekamu eddagala lya habo waliwo zino local herbs byoza baba babibugumyako ku kyoto ne bamala ne babikamulira mu maaso. Kati naŋŋamba tetwetaaga kugenda ku operation Greta tagyetaaga. Kati nawulira nga n'amaziga gampitamu. Saabazadde mbakubiriza okuba nga temukkiriza buli kintu muntu kyakugamba naye kkiriza abasawo kye bakugamba kubanga omwana omuzaala naye ate ne obuzibu nga ovudde na mu ddwaliro naye nga totegedde. So nze neebaza Mukama nti Greta wange tetwakkiriza habo naye saa zino ali bulungi.
Thanks to Mommy Greta's curiosity and determination, Greta is now thriving, healthy, happy. What initially seemed like a minor eye condition required surgery, just as many similar cases do across the country. In Ginger, childhood blindness is a significant challenge. What was a small issue turned into a major complication over time, impairing these children's vision, affecting their education and social life. Many parents are in the state of confusion, either due to family reasons, while others simply dismiss minor eye issues. Doctors attribute this to lack of awareness, only to later realize the problem has worsened beyond repair.
For example, when we talk about eye operations, people know about other operations, other parts of the body. But when you talk about operating on the eye, usually there's some element of sometimes resistance from the potential beneficiaries. So we have the challenge of making sure that there's enough information at community level that some of these eye interventions are actually essential and they can be done.
Then the misconception we get here and then maybe in schools when we have gone, most of the parents don't want their children to use specs. They say when you use a specs, you become they spoil their eyes. Children, you get them when they have a problem of low vision, when they're not seeing well. After refraction, the vision improves. But the parents will say, no, my child is going, the eyes are going to go. He's going to become blind because of these specs.
While minor procedures can effectively restore a child's vision in the early stages, surgery is also one of those efficient, necessary alternatives. It is often a swift and effective process that can significantly improve a child's eyesight. Dr. Grace, an eye specialist, provides insights into various procedures that may require surgery.
It starts right here. When we identify a child, let's give an example of a cataract. Yeah? We identify the child with a cataract. We take what we call history of how it started, what could have been the cause. Then we admit the child, and we do the surgeries free of cost. So they go to the ward. Then we buy a few of the knives, the what we call viscoelastics that we need in the theaters. Then we open up a file. Then we assess to see if they're fit for anesthesia, because children are operated under general anesthesia. Unlike adults who we numb the eye, the children are put to sleep. And during the theater, we do some measurements again. We check the pressures of the eyes, we check the opposite eye, if it's one eye, cataract in one eye. We dilate the pupils, we measure and see what power of the lens that we need to put in the eye after removing the cataract. Then we do the surgery.
Across Uganda, millions of children are at risk of preventable vision loss. Upon realizing this challenge, Light for the World and the Ministry of Health initiated the 1-2-3 I Can See program, which aims at increasing access to eye health, starting at a community level through strengthening and equipping health systems by raising awareness, increasing early detection and referral of people with visual impairments.
This program will look at the children who have been detected with eye problems, and we do early referral so that the problem does not arise or become a big challenge in the future. One of the objectives of the program is to see that we make aware of our communities that there is a big problem, and if an eye problem has been detected, we can always go seek medical advice, and the problem can be rectified by either having refraction done, which may require you to get a pair of spectacles or a low vision device, or when we find out that it needs surgical intervention, then you can always go for a surgery.
In collaboration with the Ministry of Health, this program has made significant progress in raising awareness and providing critical eye care services to children across Uganda.
As a Ministry of Health, we have different partnerships. Now, especially the one with Light for the World, where we have the Child Eye Health Care Project, 1-2-3 I Can See, in the 8 districts where it currently is. And with that, a number of ophthalmic clinical officers have been trained in refraction and equipped, fully equipped to actually do the refraction in the different places.
Of course, as we provide these services, sometimes some of the challenges are related to the state in which these patients come in. Patients sometimes come in with these long-standing eye conditions, and you find that managing them becomes a bit of a challenge. And it's where we put emphasis on prevention through our community eye health services. And in this way, we hope that when people take care of their eyes, then
the complicated eye conditions will in a way be eliminated.
Every child deserves a chance to see a bright future. Through early detection, timely treatment, and community awareness, we can prevent avoidable vision loss and ensure that no child is held back by blindness.
When we started this initiative in 2004, we formed the association. There were 4 optometrists in Uganda. As of January, we graduated now over 60. So our number has gone from 4 to 60 optometrists in the country. The Light for the World provided the operation side, so to get the workshop going, to get the devices in. So they supported a lot with that, and we got donations from Europe. Actually, there were designer frames even for that. So good quality frames, got good quality lenses, but at a subsidized cost, so people were able to get good quality devices. The people were trained were from around the country, so the services got closer. We also, with the NURI project, developed a state-of-the-art distribution service, in that we did a lot of research to find what's the most convenient, but we worked out that buses and taxis were the most cost-effective way of delivery. So we had an SMS system where the OCO would refract. We gave them a set of sample frames. They would send the prescription, the frame, and the measurements to the workshop by SMS. The workshop would make the glasses, and then we had a network of taxis and buses delivering across the country.
Basically, we produce about 60 pairs a day, provided the work is available. And the machines were all provided by Light for the World. We have right now 3 machines that do the aging processes.
Naye tubona bulungi ku lubaawo, aye okuvayo bampa akantu kano nsobola obona bulungi ku lubaawo ni mu kitabo. CONVECTIONAL, convection.
Very good.
The specs I have got, it has helped me to see very well on the chalkboard. Even if I have get my book to revise, I can see very well.
Check your child's eyes today. A simple screening can change their life forever.